Diabetes alert 10 strange skin indicators you shouldn't overlook. The complex illness known as diabetes is typified by the body's incapacity to successfully control blood sugar levels, mostly as a result of insulin resistance in our cells. It's crucial to stress that even if everything looks fine at first, years of bad eating habits, such as consuming an excessive amount of sugary foods and drinks and processed carbohydrates, as well as overindulging and frequent snacking, can progressively open the door for diabetes to develop. Furthermore, increased stress might cause the release of cortisol, a hormone which causes blood sugar to rise. Additionally, ingesting inflammatory vegetable oils and, over time, diabetes may worsen as a result of inadequate consumption of vital minerals and antioxidants. It's critical to understand the several indications your body may provide when something is off. It is feasible to reverse insulin resistance, which is good news. Potentially stop the development of diabetes or prediabetes if you believe you could have prediabetes or diabetes. I highly recommend watching this full video. We'll also explore homeopathic treatments as well as dietary guidelines intended to lessen insulin resistance and possibly reverse diabetes. Of course, if you have any medical concerns, it is imperative that you speak with your healthcare professional. After identifying the early warning, we focus on the first sign, which is the emergence of dark spots on the skin. These patches usually appear in your body's creases and folds, like the back of the neck, the groin, or the armpits. The primary cause is an overabundance of insulin and sugar in your blood, causing skin cells to proliferate more quickly. The concentration of melanin pigment in these freshly produced cells is higher than normal, producing a complexion that is noticeably darker than the surrounding skin. Moreover, these patches may become velvety dry in texture, and some people might additionally encounter the emergence of several tiny growths or skin tags in these regions. This brings us to the second sign that skin tags are present. Although a few skin tags are typical, a considerable increase in their incidence may indicate a pre-diabetic underlying problem, or higher than normal blood sugar levels. An increased blood level of insulin can weaken your immune system, possibly causing the human papillomavirus HPV to reactivate, resulting in the development of fresh skin tags and occasionally warts. Notably, a natural regression was frequently observed by those who effectively managed insulin resistance, and the skin tag's elimination. The feeling of tingling in your feet is the third symptom to be mindful of. Though hardly perceptible with the naked eye, you may feel things like deep tingling. Your feet or toes may hurt in a burning, itchy, irritating, stabbing, or even electric-like manner. Your feet's damaged nerves are the source of this discomfort. Because to diabetes or consistently high blood sugar levels, which damages these nerves' outer layer of defense, making them short-circuit, much like a broken electrical line. Adding a daily medication such as benfotiamine can help to reduce this nerve damage. Nevertheless, I'll go into more detail about diabetes control techniques in a later section of this talk. Let's now investigate our fourth signal: fungal infections of the toenails. People who have high blood sugar or prediabetes are more likely to develop toenail fungus infections. As a result, the toenails get thicker, discolored, and yellow. Frequently accompanied with recurrent infections of the athlete's foot that cause cracking, causes severe skin itching on the soles of the feet and around the toes. It's important to realize that fungus loves sugar, and the greater your blood sugar levels, the more favorable conditions on your foot become for the growth of fungi. Furthermore, urine immune responses were compromised by diabetes and prediabetes, increasing the risk of fungal infections on your skin. It can also include ailments like jock itch, yeast infections, and ringworm. Now, for our fifth skin-related warning sign, bed sores or ulcers should be closely monitored. Those who eat an excessive quantity of processed carbs, the battle with diabetes or insulin resistance, may see the development numerous open wounds on their body that take a long time to heal. The main reason for this delayed healing is to the harmful effects of high insulin on the blood vessels that are beneath these ulcers. Interestingly, between 15 and 25% of those with diabetes will have to deal with diabetic foot ulcers at some point in their lives. The existence of tough skin on the fingers is our sixth indicator. There may be a discernible thickening and a waxy look on the knuckles. Hands and fingers, especially when insulin resistance is present. If dietary changes are not sufficient to control diabetes, it may cause your hands to become more rigid and give you the impression that your fingertips are made of stones. Let's now examine the seventh sign, which is indicated by the fingers pointing forward. In addition to the rigid skin symptom that comes next, which is the sixth sign, people with diabetes frequently experienced finger stiffness, ascribed to the fascia underneath becoming thicker. On the palm of their hands, some people may notice the appearance of tiny lumps or nodules beneath the skin, which, while unpleasant at first, usually goes away with time. Insulin resistance and increased insulin levels are the main causes of this condition, both having a role in the hand's aberrant fascia development and thickening. Let's move on to the eighth sign, shin spots. Diabetes and high blood sugar can deteriorate the blood vessels in the legs, causing blood byproducts to seep into the skin. This may lead to the creation of circular, dark brown, reddish dots that are frequently seen on the lower thighs, especially around the shins. Although these patches usually go away in 18 months, patients with diabetes frequently experience them because of the harm they inflict, by elevated glucose or insulin levels to the blood vessels under the skin. The appearance of skin nodules is the ninth warning sign. People who have diabetes or who are at risk of developing it frequently have blood cholesterol levels that are higher than normal, which the liver finds difficult to process. This may result in the development of tiny, hard, elevated areas under the skin, cluster-like formations that range in size from 1 to 4 millimeters. It is important to remember that these lumps may also be a sign of renal, liver, or thyroid problems. Should you observe any of these anomalies on the skin, please see your doctor for a comprehensive assessment. Finally, we reach the 10th indication. Swollen eyelids. Water is favored by high blood sugar or glucose in the blood. That being said, those who have high blood sugar and diabetes could develop bags under their eyes. Although swollen eyelids by themselves might not always indicate prediabetes if they coexist with any of the symptoms that were previously addressed. It might be a sign of an underlying blood sugar problem that, if ignored, might develop into diabetes. If any of these symptoms seem familiar to you, it is highly advised that you get medical assistance. Then ask your healthcare professional for a home IR test. This easy blood test determines your insulin and fasting blood glucose levels, giving you important information about whether you have diabetes, insulin resistance, or prediabetes. To determine your average blood sugar levels over a prolonged period of time, you should also think about having your A1C levels analyzed. Should you discover that you require medical attention for an illness, it becomes imperative to investigate ways to undo it. As was previously said, insulin resistance is the main cause of diabetes, a disorder in which your cells don't react to blood sugar levels sufficiently to cure insulin resistance or diabetes. The secret is to maximize cellular activity in order to effectively absorb more sugar from your blood, which will eventually control your blood sugar levels. By incorporating the following 6 suggestions into your daily routine to improve your general well-being, you can facilitate this process. First, give cells and insulin receptors time to heal, to keep blood sugar levels steady and lessen insulin resistance. Think about cutting back on the high glycemic foods that quickly turn into sugar in your blood. Bid farewell to starchy meals, sugary snacks, and goods made with refined flour, such as cookies. Processed carbs, such as chips, candy, bread, pancakes, pasta, ketchup, and soda. Reducing your carbohydrate consumption will increase your sensitivity to insulin, allowing your blood sugar to return to balance. 2. Accept good fats. Replace processed carbohydrates with avocado's healthy fats, eggs from a pasture, butter from grass-fed cows, extra virgin olive oil, and raw coconut oil. When paired with proteins, these fats can help you maintain your energy levels, reduce your appetite, and help the body's insulin resistance to reverse. 3. Use spices and herbs that are anti-diabetic. To counteract insulin resistance, think about using anti-diabetic herbs and spices in your diet. Good options include fish oil, apple cider vinegar, black seed oil, berberine, cinnamon, green tea, bitter melon, and turmeric. These compounds have the potential to improve insulin sensitivity and control blood sugar levels. 4. Give organic cruciferous veggies top priority. Make it a habit to eat organic cruciferous vegetables like collard greens every day. broccoli, Brussels sprouts, cauliflower, cabbage, and Swiss chard. These veggies are abundant in magnesium and potassium, vital elements that increase insulin sensitivity in cells. Their phytonutrients and soluble fiber can also immediately control blood sugar levels. 5. Engage in sporadic fasting. Disrupt the pattern of munching continuously throughout the day, a substantial cause of insulin resistance. Consider intermittent fasting instead when you consume all of your daily calories in a 6-hour period, giving your body 18 hours to relax and digest. Fasting is a powerful method that can improve digestion, reverse insulin resistance, and open up your cells. 6. Place a high priority on restful sleep. Getting enough sleep that restores your body is essential for controlling insulin resistance. People with diabetes frequently have trouble getting a good night's sleep. It may result in higher blood sugar and cortisol levels. In order to improve insulin sensitivity, try sleeping for 1 or 2 more hours each night. Or, if possible, include naps during the day. Enhancing the quality of sleep will help to stabilize blood sugar, lower stress, and regulate hormones. Together with these changes to lifestyle, you might also think about incorporating particular vitamins, minerals, and vitamins into your routine to help with insulin resistance even more, and diabetes, while keeping a healthy, balanced diet. Remember that each person will react differently. Therefore, in order to properly manage your illness, you should always speak with a healthcare provider before making significant dietary or lifestyle changes. Please like the video and subscribe to my channel to learn more about this issue. I would like to thank you for watching this video. My best wishes for continued safety and happiness.